Thanks for watching, everyone. Today we have an awesome guest today. We have a patient, Elaine, that is going to tell her story about a really severe disc herniation that she went through and kind of the road that she traveled to get better. So Elaine, thank you for being here today.
Thank you for having me.
Absolutely. So let's talk about, so when did this originally happen? When did you start feeling pain?
I woke up one February morning and couldn't actually get out of the bed.
So literally out of nowhere.
Yes. I mean, I had gone to an exercise class the night before and something felt a little odd, but that happens at Pilates, right?
Yeah, that does.
And the next morning, I really couldn't get up. It was
Excruciating.
crazy. Yes,
Yeah.
excruciating.
So what'd you feel? Like, were you feeling lower back pain? Were you feeling buttock pain, pain in your leg?
It was in the back and all the way down my leg. I mean, the entire side of my body just froze up on me.
And this was your left leg, wasn't
Yes,
it?
it was.
Yes. And tell me, like, scale of 1 to 10, how bad was your pain?
Well, at one point, because I was by myself at the time, I was forcing myself to get up. One has to get to the
One has to
bathroom.
do with, yeah, that's true, that's true.
I actually blacked out. I stood up and the room started to kind of like spin on me, and then the next thing I know, I woke up and I was on the bed. So I had kind of passed out from the pain, and fortunately the bed was right there, or that could have been horrendous.
Absolutely, you could have had a head injury.
It only happened one time that it was that incredibly intense, but yeah, I guess one can black out from pain, and I've learned.
Yes, sciatic and back pain is no laughing matter. It can just be awful. Yeah.
It was crazy.
So you had all this pain. What was your first kind of steps? Like, what were you thinking?
I was clueless.
Were you?
No
previous history of back problems?
Back problems that had come and gone, you know? After childbirth, my back hurt a little bit.
Little achy
it happens,
pain,
yeah.
this and that.
Or I'd spend my time working in the yard, and the next day, but it was always something that you could kind of ignore, or if I just kind of stayed on the sofa for an afternoon, I was fine.
Sure.
Nothing that ever suddenly kept me from getting out of my own bed.
Right. Nothing that was long lasting.
No.
Nothing like this.
So that was totally bizarre, but fortunately, my husband had back injury from a bicycle accident from when he was younger, and he's like, "This sounds like a back problem, and you need to go to a chiropractor."
Okay.
And so he kind of took over at that point, and I wasn't very coherent anyway with so much pain.
I see.
So
I see.
He really drove.
So he took you to a chiropractor first.
Yes.
Yes.
Absolutely.
And then you had some spinal adjustments, I think.
Yes, and they said that they thought I was like. It was almost 4 inches. He had not seen a right and left side pelvis be that out of alignment.
Right.
It was
likely because of all the muscle spasm, because your spine was protecting itself. Yeah, so your muscles were tensing up, and especially on that one side, so you were sort of in a splint. Your spine was probably looked very crooked at the time because of the spasms.
Yes, it's been proposed that I guess as the disc was deteriorating, that I had become more and more crooked, but I had been compensating and didn't even know it.
Correct, yes. Right? So these problems really do sneak up on patients. We see that all the time. No previous history of a back issue, and then a cough or a sneeze, or maybe a little bit of an excessive workout, and then the next thing you know, patient's in severe pain, and they're like, what on earth did I do? And then so chiropractor first, and then shortly thereafter, I think you had come across Texas Spine Clinic.
Yes, I just needed to make the appointment, and so that chiropractor was there on a Saturday, got me quickly adjusted so I could at least get. I would have had a hard time getting here otherwise.
Right.
And so then I could come see you that week.
Yes, I literally remember your very first visit, and it wasn't easy for you to make it into the office.
No. Even Logan was saying, I remember when you were desperately holding the cane and having to hold the wall just to try to get in the room. And of course, everybody was so helpful with the doors and getting me to a table, because it was just comical. It really was.
I mean, hard to imagine barely being able to walk and then just a day before you're out doing Pilates.
Yes.
And everything's normal, and then suddenly, boom.
Everybody kept asking if I had been in an accident or what I had done, and I'm like, I didn't do anything.
Yes, exactly.
Oh.
So we evaluated you that first day. We sent you out for an MRI.
Yes.
Immediately. Got the MRI back, and lo and behold, what'd we see? Bad herniated disc. I mean, not a little. Everybody kind of talks about, oh, I've got a slip disc in my back, and by and large, statistically, 50% of patients with no pain at all have significant MRI, like positive MRIs, bulging disc, herniated disc, degenerative disc disease, and they don't even know it. So in your case, you had what we consider a whopper, a 1+ centimeter. So that's 10 millimeters plus disc herniation, crushing the descending nerve root. So the nerve root was literally being pushed out of the way by the herniated disc, like literally. When the disc comes out, it pinches the spinal cord, really stops about here in your lower back. So we just have a bunch of nerves hanging down like spaghetti strings, and your nerve root hanging behind your disc was literally pinched around the disc herniation. Literally thousands of times since we started doing this treatment in 2006. So we've been using the DRX now for nearly 20 years, treated several thousand patients on the DRX, seen this many, many times. So we really have a great grasp on what works and what doesn't. Even in whopper situations like this, we know the DRX can still be extremely effective. So within, we probably put you on the machine that same day after we got the MRI back. So we got her started on treatment right away, and within probably 2 weeks, you were probably starting to be able to function like a human.
It was getting better.
Yeah,
yes.
It was slowly getting better.
Slowly getting better.
I remember the biggest issue we had that was challenging to overcome was just being able to stand in one place without the nerve hurting.
Yes, standing still.
Standing still.
Trying to stand
sort of
for
as long
30
as
seconds.
you were walking, you were sort of okay up to a point.
Right.
But so kind of the first step, and you got to imagine this is a disc herniation that if Elaine had not found out about us, she would have been going basically straight to a spine surgeon.
Right, and that was not something I wanted to do.
Right, any spine surgeon, any spine surgeon would have seen this and said, wow, you have a very big disc herniation. It is crushing the nerve. We are probably gonna really need to do spine surgery here. 10 out of 10 surgeons would have likely recommended spine surgery sooner than later, if not immediately. So, but obviously with the success that we have with the DRX, I was like, hey, look, we've got a great shot of beating this and not undergoing surgery. So we put her on the machine, obviously started to see gradual improvement. Patients typically don't go from a pain level of a 10 or a 10 plus, as you heard from Elaine, down to a 0 fast. This is a process, it takes time. Most patients go through the DRX treatment for at least about 6 weeks, and sometimes in some cases obviously longer. It takes time for that disc herniation to resolve. That disc herniation is a ball of material. And as the DRX unloads the spine and it's stretching, it's pulling fluid in and it's sucking that disc herniation back in and helping to resolve the size of that disc herniation. So over time, we're literally shrinking the disc herniation. So, and of course, this doesn't happen in 2 weeks. So, but we're getting the patient going in the right direction.
But I did appreciate you from the beginning. You said, you're going to have to be willing to spake the time, that
That's
this
right.
wasn't going to be immediate.
That's right.
But that if I stuck with it, I could probably avoid that dreaded surgery.
That's exactly right.
And we have. It's been
several
months.
Yeah, so
since February, and
it's been
December.
9 months.
It's been 9 months.
It's almost Christmas, 2024. It's been 9 months, and
but I'm only down to once a month treatment.
That's right. So we do, for big disc herniations like this, we generally will treat the patient about once a month just to continue stimulating healing in the disc, because it can take about 6 months to a year to get that disc herniation to suck all the way, or suck in as far as we can get it to suck in. And I tell every patient, hey, look, your disc is never going to be 100% after it was injured. That's not the goal for it to look pretty on an MRI. The goal is to get you better to get you back functional and avoid a risky procedure like a back surgery that most people really don't need. I mean, yes, there are times where back surgery is 100% necessary, but certainly in the cases where we feel confident we can help, this is the approach we should always take first and let back surgery be a last resort for sure. So let's talk about, like, how are you doing now? Let's talk about physical activity level. Like, how do you feel at work?
I am doing fairly well.
Yeah. Pain scale 1 to 10.
No pain. I haven't had pain in weeks. So, you know, I'm really doing well there. I do find that, you know, from being laid up so much, I don't have the strength I used to. So I'm having to do a lot more of the back exercises and try to get myself endurance-wise. Because for months, I was nothing, right? Just barely getting here, go to work, sit in my chair, get in the car, come here. That was...
I mean, you were having difficulty walking down the hall to go to your neighboring offices to do what you needed at work.
Exactly.
It was like, okay, I need to plan my day, and I'm okay sitting, but I need to walk down the hall.
Our people come to me.
That's right.
So I'd say, you know, at work, most people, I mean, they remember it, but these days we don't even talk about it. I move around at work the way I need to.
That's right.
I do find sometimes if we've been out all day walking around shopping and things that I can get tired towards the end of the day. And it used to be tired meant the next day was going to be a little rough. But at this point, even getting up the next morning, I'm okay.
Yes.
So, you know, it's remembering how bad it was, and each day going, hey, you know, guess what I can do today?
That's right.
I can go down the hall, or hey, I worked out yesterday, and today I'm still a person.
Yes.
So yes, doing much better. Uneven surfaces every now and then. It's like, oh, yeah, there's a little bit of that.
You can still feel a little something.
Yeah, there's still a little of that. But there are plenty of days where I don't even remember that we have a problem. So
that's incredible. I mean, and this is, so to give you guys an idea about how many treatments a patient can typically go through, the initial course or sessions is typically about 20 to 25 sessions. And then we sort of start really spacing them out if we have to. And I mean, Elaine might have gone through maybe around 30 at this point.
I've been, for a lot, because the first several months I was here 3 times
almost
a
every
week.
day. Yeah. So that initial
three
course.
3 times a week.
Well, so typically we'll see patients, especially acute patients, 4 times a week for the first 2 weeks, and then 3 times a week, and then we start sort of spacing out the treatments from there.
And we had to stay at 3 for a long time.
For a long time.
That nerve just would not
Oh, it was stubborn.
give in.
The nerve was stubborn. No question.
And
Bad problem.
of course, the 2 injections helped, and then the treatments.
Yes. And so because our office is integrated with an interventional pain practice, we have physicians able to do interventional procedures when necessary. So we had Dr. Singh, I think, do 2 spinal injections.
Just to get that nerve under
calm down.
Yes.
That's right. To kind of get her over the hump so that we could tolerate continuing to do treatment.
And the back exercises, because I was really having trouble with the exercises until that nerve quieted down.
That's right. Yeah. Oh, of course. Absolutely. So being able to get the inflammation down allowed you to be able to do more exercises, more activities, start rebuilding the stamina.
Right. Had to break that cycle.
Oh, that's right. That's exactly right. Yeah. That's the whole purpose of doing all of the things that we do in medicine, is to try to break that inflammatory pain cycle that is literally perpetuating itself by the problem. And once that nerve gets wound up, it takes a lot. Even sometimes surgery doesn't relieve that wind up of the nerve. And then patients can continue having problems, which this is a very complex issue. It's not just so simple. It's not just, oh, I've got a pinched nerve. There's a lot of physiology going into how the whole pain and inflammation and the whole cycle exists. And it's not just as simple as removing the disc herniation, because we have a lot of other things going on. So that's why the DRX typically has been shown to be so effective, because we treat a lot of the issues simultaneously. We treat the flexibility of the spine vertically, because we're stretching the spine, obviously. We're taking pressure off the nerve, we're decreasing inflammation, we're helping to relax the muscles, we're starting to strengthen the spine, so we're improving spinal function. So we're not doing one simple thing, just like in surgery, they just take the little piece of the disc out. You know, we're actually rehabbing the spine all simultaneously, which is why we have a success rate like we have. So anyway, well, that's a remarkable story given, I mean, obviously I saw you walk in that first day. I saw you on a cane. I mean, I've seen this, like I said, for nearly 20 years, our whole career. We've been using the DRX 9000. It never ceases to amaze me. I've seen it.
It's been incredible.
Well, and I'm
everyone
glad it
here
has.
has been so great.
Thank you.
I
Thank
really
you.
have.
Yes, I really appreciate it. And thank you for being willing to share your story so that other people with similar conditions, whether it is a herniated disc, a bulging disc, which we would sort of put in the same category. Sciatica is caused from these herniated discs. So if you have sciatica, herniated disc, bulging disc, degenerative disc disease, all of these conditions can be treated with the DRX, spinal stenosis. So call Texas Spine Clinic, get scheduled for a consultation. We'd love to see you in the office and see if maybe hopefully we can help you avoid back surgery.